Thank you so much, Stephen Bide. We now get into the heart of the discussions for the day, the 25th of March, 2025. It is Morning at NTV. You are most welcome. I am Priscilla Regina Naloga. Now, this morning we start off the discussions with a look at Uganda's state of hygiene and sanitation, tackling the poor hygiene and disease prevention. As a country recently concluding a National Sanitation Week 2025, it is a national-wide initiative aimed at promoting proper hygiene practices, but also improving sanitation to improve the spread of hygiene-related diseases. Now, launched by the Ministry of Health, this was on the 19th of March 2025 in Katanga, Kampala slum. This was concluded on the 27th of March. It's been a long week campaign with the theme Sanitation for Dignity and Inclusiveness. We are privileged to be having officials from the Ministry of Health as well as supplementary partners to be able to help us break down hygiene and sanitation. Why is it still a big and important conversation in 2025 with all the initiatives that have been done, with all the programs that have been implemented, and yet we still have a disease burden for hygiene-related diseases? Allow me to welcome my guests with me in studio. I will start with ladies because it's March, so obviously we shine light on ladies. So Dr. Nabasa, you'll have to wait a little bit as we shine light on Dr. Joyce Mpalani, Country Director, Water Aid Uganda. Happy Women's Month, and how are you?
I'm very well, thank you, Priscilla. Thank you so much for hosting us this morning. It's my pleasure to join NTV this morning to talk about sanitation issues. Okay. Thank you very much.
It's a Women's Month. Allow me to divert a little bit. As a woman leader, what have you found as the privilege of being a woman in leadership in this line of work?
Thank you very much. For me, getting a woman into leadership is like really lifting a nation. Because given our triple role as women, we know how to nurture, we know how to engage in productive activities, but we also know how to really lead. So for me, being a woman and a woman leader has enabled me to lift other women. And for me, that is very important. I like mentorship because myself I've been mentored in the past years of my career. Okay. So I consider mentorship of young people and mid-career professionals as very important to me.
All right.
Yes.
As women, we have accepted that we can't stand alone on this journey, and so we appreciate the men that stand alongside us. Dr. Herbert Nabasa, we do appreciate you as a man in leadership for making room and opening doors and allowing the boardrooms to be shared with you and women by and large. So on that front, we want to say thank you so much and good morning.
Welcome. Good morning, Priscilla. Good morning, viewers. Thank you once again, and privileged again to be here to speak about these national level issues, issues of national importance, and they matter a lot in terms of service delivery, especially to have a healthier and cleaner environment.
Yeah, putting you on the hot spot. Yeah. Why is it important that women should take up leadership roles?
Well, like Joyce said, you cannot have a successful man without a woman alongside. So we know that leadership starts at home. So when you have a mother, already you have a leader at home. So you nurture children, you nurture behaviors, you nurture attitudes, and these are the same behaviors and attitudes that go along into the workspaces. So once you have a woman that is rightfully doing their role, we know that we can have a nation that stands on shoulders.
All right. Thank you so much, Dr. Nabasa. We're also going to be joined by Dr. Diana Twine, who's the Permanent Secretary under the Ministry of Health. But diving into it, Dr. Nabasa, talk to us about the current state of sanitation and hygiene in the country, especially for the underserved communities.
Thank you, Priscilla. And it's good that you underscored the fact that we did launch our sanitation in Kampala. The idea of launching sanitation in Kampala was basically to look at the cities. For the first time in the history, we got the outbreak starting in the city, the Ebola outbreak. And that was worrying us because normally we know that it is linked to the villages where probably there's a human-animal interaction. But this time around, we had the outbreak happening in the city and starting with our healthcare workers, and we lost a nurse. And so this year we launched sanitation because the gap between prevention and disease actually is big currently. We see that over 75% of the diseases are preventable, and so the call to action is important. So sanitation and hygiene are very key in terms of actually addressing and destroying the transmission lines. Because when you look at cholera-related diseases, water-related diseases, and hygiene-related diseases, they can only be tackled when you have a clean environment, a clean home, and a clean facility. And so we are speaking at the value chain processes, where from a home up to office, like where we are right now, we have access to safe water, access to proper sanitation, and access to hand hygiene. And so we speak about this and bring in the context of attitude, because they are personal responsibilities. And so because sanitation is key and hygiene are key, you cannot divorce them from the human beings, because we have to be responsible for our actions.
Okay. All right, I'll come back to you, because you mentioned cities, and I realized that here in NTV we've done so many stories of major cities having issues with garbage, which then affects the hygiene and sanitation of the city by and large. Dr. Mpalani, in this regard, as Water Aid Uganda, I know that you do have a strategy that you embarked on from 2023. It's running up to 2028, and this is to transform lives to have sustainable and safe wash. Talk to us about that.
Yeah, thank you very much, Priscilla. As you have rightly mentioned, we are in our third year of implementing our country strategy in Uganda, and our strategy approach builds on systems strengthening. What do we mean by system strengthening? It's about building structures. Structures at all the different levels, right from the communities, sub-counties to district level and national level. So we've always had a tendency in the past of focusing on infrastructure development, which is, the water sources, which is the toilets and toilets. But now, as Water Aid, our approach is to ensure that we look at the entire system of an institution. We are looking at planning, which is a major aspect of water and sanitation development. And we are looking at budgeting. We are supporting the different partners we work with to make sure the planning and budgeting cycles are inclusive. They cater for the needs of the communities. It is participatory. But also when the services are being delivered, we are looking at monitoring of the services. How are they being delivered? We are looking at the long-term operations and maintenance, which is very critical when you're looking at sanitation and hygiene. Will this be sustained? How will it be maintained? How will it be operated? I'll give you an example. We are working in eastern Uganda with the government of Uganda, and we've supported the Umbrella for Water and Sanitation Eastern Region to make sure that they build their capacity to ensure proper accountability, but also we come up with models that can endure beyond the donor support.
Okay. All right. So you have talked about planning and budgeting. From the side of the Ministry of Health, Dr. Nabasa, on a national spectrum, we do have the cities who, do their budgeting, and through the budgeting process, I trust that the Ministry of Health should have guidance and maybe backing them up to get this money in order to then ensure that they have sustainable and safe wash for them as different cities. How best can the ministry actually support budgeting and planning?
Yes, thank you so much. And of course, as you put it, this country is running a decentralized system. And that means that power and planning and budgeting belongs to the authorities. In that case, the local government authorities and cities. We have new cities, 10 of them, and I think new other cities are coming on board. Our role has been to see how we can support the local governments to prioritize critical issues such as sanitation and hygiene. How do we do that? First of all, you know that our planning is a bottom-up process. And so during the budget conference meetings, we normally support them so that they prioritize issues of sanitation and hygiene and among other health service delivery issues. And so every local government has a focal point that sits in a district technical planning committee. And normally we go ahead to support them in the planning process. But what is important is that they have very limited budget. Even when they plan, the money that they have in terms of the revenue generation, local revenue generation, but also from the central government grants, still the money is limited. And so when we engage them, we are engaging them to take up innovative approaches. How do you do that? You look at the priorities, but also you look at working an integrated manner. Take, for instance, the projects to do with water and roads. You realize that the roads have a lot of impact on the environment. So when you're constructing the road, you leave a lot of damage through the marram ball pits, and in a way you're creating breeding sites for mosquitoes, and then that becomes now a problem to the Ministry of Health. So once you encourage them to do integrated planning, then you link projects to health, such that you can access financing for projects that don't have the finances. When you look at water, for instance, you have big water projects. These water projects sometimes don't forget about sanitation, because sanitation normally is treated as a silo, as a standalone, yet you cannot have proper water without proper sanitation. So the linkages is what we encourage the districts to do. First of all, to plan and avoid siloed planning, but also to ensure that they deploy innovative financing of some of these critical health service deliveries.
Okay, all right. For the case of garbage collection, which is affecting our sanitation in cities and hygiene across different major cities, Jinja, Kampala, to mention a few, you do have at the district level the health officers. What is their responsibility in ensuring that this is actually dealt with in time? Because I will tell you the truth, as citizens, as communities, we have really improved in managing our waste. We now know if there's no dumping site, there's a cavera. In those arcades, there's now different dumping pits. And then later on, they're collected by the different responsible entities and put in a central place. But then the management of that central place is definitely going to affect the other elements that are connected to sanitation and hygiene.
The biggest challenge has been a planning issue. Many of these cities are established without proper designated landfills or areas where waste can be sorted, properly disposed of. You find a whole town doesn't even a designated landfill. Even as big as Kampala, we're still struggling, where we had Chitezi landfill, waste landslide or waste slide, where falling on people and killing people. Right now they are relocated to a new site, and if it's not well planned, again it's going to end up as the issue. So it's a planning issue for the cities. Much as our officers are struggling to support, but the districts and municipalities and towns ought to have proper planning of their waste, such that in their budgeting, they have proper designated process for disposal of waste. But also they don't stop at that. They can also have mechanisms for turning this waste into usable material. I remember back in the days where we supported municipalities, I think Ministry of Water and NEMA supported municipalities to set up waste dumping, waste composting plants, where all their garbage is supposed to be, created into a compost, and then that compost is supposed to be used into making manure or briquettes for energy and other sources. So you can have waste to energy, you can have waste to agriculture, you can have waste to money, because now making this recycling also generates money in one way or the other. So the cities have been encouraged, our technical officers have been taken on in terms of skilling them, but also engaging them to be able to support the towns in a way that waste management can be taken on as a priority. But it's a bigger issue than the officers. It's the issue that actually the districts and the country must take on
as a priority.
As a priority.
Okay.
Yes.
I know that Dr. Mpala and WaterAid Uganda has tried and tested initiatives or solutions that you have implemented over the course of time that can actually be a problem solver on a national level. Could you talk to us about some of those?
Yeah, as WaterAid, we are working with partners, and mostly government is our major partner. When we look at sanitation, for example, we've come up with models that are gender responsive, that really speak to the needs of girls, to make sure that the girls do not drop out of school. that the girls do not drop out of school because of poor sanitation. And we've also come up with different technologies to make sure that women who bear the burden of collecting water and also maintaining sanitation can be able to really have user-friendly technologies. For example, we've worked in Mbale City, and we've come up with a model public toilet. This public toilet has room for disabilities. It has room for where mothers can sit when they've gone to the bathroom. And also in schools, we make sure that we have segregated sanitation facilities for girls and boys, where the girls have a washroom that can help them when they are into their menstrual cycles. This has really improved on the enrollment at these schools where we've worked. School attendance has improved, and also school performance has improved. But also at the public toilet in Mbale City, it's the women who have been trained to take care of this public facility. Because as we started this conversation, women bear the burden of water and sanitation. If you train them, then you are empowering them to make sure that this facility is well maintained so that it can stand the test of time. But also we are working in healthcare facilities. And with the support of Dr. Nabasa and his team, we were able to support so many healthcare facilities in the Eastern region. And this is a full package whereby when we go to this healthcare facility, we make sure there is running water in these facilities. There are proper toilets. And the impact has been mostly, if you look at the mothers who come to these healthcare facilities to deliver babies, they have the opportunity of accessing water that flows all the time. But also we've installed solar panels so that they can also access warm water for their babies. But also we know that at these healthcare facilities, so many activities take place. There is immunization that takes place. There are so many mothers who come with the young ones to be immunized. We've provided water purifiers so that they are able to access drinking water at these facilities, but also building the capacity of the health workers. I think that is one of the most important activities that WaterAid has supported. The health workers have been supported into life cycle costing. They know the cost of these facilities. They know what it takes to maintain them. They know how they can maintain these facilities. But also when you look at, for example, the umbrella for water and sanitation, we are trying to improve, to enhance performance of the umbrellas for water and sanitation so that they are able to improve on customer care. So we've supported them to extend water to the different communities, and also build public sanitation facilities, especially at the markets. Because you know how many people spend time at the market, but without a proper sanitation facility, then hygiene cannot really be properly maintained.
All right. Dr. Joyce, I know that climate resilience is also embedded in the work that you're doing, and we have to be realistic. Climate change does affect our hygiene and sanitation. In that regard, what are some of the responsive mechanisms that you have also adopted?
Yeah, one of the things that we are really doing, actually we even have a fully fledged adaptation fund project that we are implementing in Mbale. It's not only in Mbale, it's in 11 districts. And this project looks at climate resilient water and sanitation infrastructure. What do we mean by climate resilient? We are looking at those toilets that will not be swept away when we have a lot of rain. We are looking at facilities, the water facilities, where the water sources will be very well protected and they will not be damaged when we have those extreme weather patterns. We are looking at developing the capacity of the communities so that they can be able to be trained in early warning systems, and to make sure that the community's capacity to adapt to the weather changes are built. So that is what we are really looking at, and we are doing this in 11 districts. We are working jointly with the Ministry of Water and the Environment. The Ministry of Health is involved through the decentralized structures because there is the component of hygiene and sanitation. So the Rural Water and Sanitation Department is mobilizing the communities, raising awareness on the importance of hygiene, and also promoting sanitation development, but also mobilizing the resources at the district level to make sure that communities' awareness is enhanced to know the effects of poor hygiene and sanitation. So that is one of the projects that we are working on.
All right, thank you so much. Dr. Navasa, she has mentioned something critical, adaptation plan, and I know that we have Uganda's WASH, National Adaptation Plan. How does this plan actually align with the global climate resilience goals?
Yes, Priscilla, you know, not only that, but Uganda recently launched their first ever Health National Adaptation Plan. Ministry of Health is in lead. The idea is to align with global commitments, where we're supposed to have a resilient health system. And Dr. Joyce alluded to resilient health system, where you're talking about providing preparedness, but also shocks. When you have flooding, for instance, how does it impact on our health facilities? Where do you locate them? Where do you locate the latrine facilities, for instance? How do you build a team that is resilient and more, focused on planning and budgeting for climate change in the health system service delivery? So climate change, adaptation, and health are very linked, because whatever happens in the environment ends on the human beings, on the health point of side. So Ministry of Health developed a plan together with our partners and in line with the global commitments. And so we are now looking for resources to be able to scale up this plan, and we're able to have systems that are resilient and can cope. And issues of sanitation, for instance, having sanitation infrastructure that stands time.
I was going to ask then, what role does sanitation play in the framework?
Yes, because for instance, sanitation, like we know, it's having facilities that support hygiene, support the disposal of fecal human waste, both fecal and urine. And so if you don't have proper located structures, then climate change will impact them directly. We have had scenarios like in Elgon area, Renzori, even in Kampala here, where sanitation structures are washing down completely. And so that implies directly that you're going to have a huge burden on the health, where you have the potential cholera outbreaks. And then you know that our statistics are still not good, where you have almost 33 children dying every day due to cholera. You have stunting due to cholera, and that impacts now on their education way of life.
Okay. Dr. Joyce, how can us as a country actually better mobilize and coordinate resources? For example, finances that Dr. Nawaz has talked about. There's the technical aspect of it, and of course the human capital to scale up sanitation solutions.
Yeah, thank you very much, Priscilla. Resource mobilization is very critical, and it's one of the building blocks in the systems approach. So as WaterAid and other civil society organizations and development partners, we really pay a lot of attention to resource mobilization. And we should all know that it is a shared responsibility. As development partners, we've supported the local governments, but we cannot replace public financing. So we are calling upon government to increase budget allocations for sanitation, especially at district level. Equally important is coordination among the NGOs. We have so many NGOs, we have different donors and funders, and at times you find there is a lot of duplication in our services. So we are calling upon increased coordination so that we can avoid this duplication and align our work for greater collective impact.
Okay. All right, we're going to be taking a short breather on this discussion. We're going to be joined by the Permanent Secretary to the Ministry of Health to help us answer the commitments that you're asking for, increasing budget allocations, among other things regarding WASH in Uganda. Do stay with us. Welcome back to our Kickstarter. We are having a conversation regarding Uganda's state of hygiene and sanitation, tackling the poor hygiene as well as disease prevention. We've been having this discussion with Dr. Nabasa Hubbard from the Ministry of Health as well as Dr. Joyce Mpalanyi from Water Aid Uganda. Now we're being joined by the Permanent Secretary to the Ministry of Health, and that is Dr. Diana Atwine. Good morning to you.
Good morning.
And how are you?
I'm fine, thank you.
It's a pleasure to have you. We want to look at sanitation and hygiene in the country. I know that the Sanitation Week was launched in Katanga last week, and it was under the theme Sanitation for Dignity and Inclusiveness. What is the importance of sanitation and inclusiveness?
When we talk about sanitation and inclusiveness, we are looking at bringing everybody on board, big and small, man and woman, the old and the young, to make sure that we take care of our environment, because our environment is our mother. So when we talk about sanitation and inclusiveness, and specifically last week we launched in Katanga, because as you know, in Kampala we have sections of our population, especially in areas where we have informal settlement, what we call slums in our normal language. We see low socioeconomic status people living in, not only in Katanga, we have quite a number of places in Kampala. And in those places, when you go there, you really see that, first of all, the settlement is not organized. Secondly, you have a lot of sewage issues. Waste management is at its lowest. And so we felt really that we need to go to the people who need this message more. Because when you go to high-end urban setting, you find those issues. They are there, but they are not as pronounced as in the informal setting. So we really want to bring everyone on board, because we think that if we tackle the sanitation issues in this informal setting, that contributes so much to the disease outbreaks. Every time we have disease outbreaks in Kampala, those disease outbreaks normally begin in those informal settings. So we want to go to where the problem is. And when we talked about inclusiveness, we wanted everybody to be part of this solution, not to be left it to the leaders in the KCCA, or some political leaders, or some other companies, or Ministry of Health, but we want everybody to be part of this solution, because we do believe that everybody has a role to play. Everybody contributes to sanitation. Everybody contributes to either making environment worse or better. So we are just sounding the message to the population to recommit, to acknowledge the problem that is at hand, and also to emphasize to commit and make everyone commit to this solution, because nobody will have partners, and I was mentioning it when we were in Katanga, that nobody will come and tell us to sweep in our home. Nobody will come and tell us to dispose proper, with the waste. We have solid waste, we have sewer, we have all that. everybody has a role to play, and it cannot be left to government, because I have always had people say, oh, government to government. It can't work. It just can't work.
Dr. Twine, in that regard, I know that you had interactions with the people in Katanga. What are some of the challenges that they presented to you in saying that in as much as we are trying to play our part and our role in inclusiveness, we are faced with these challenges in order to, have a better health around hygiene and sanitation?
I think the biggest issue is, I would say, the biggest issue is the mindset. The mindset, because it's not just about money. Because I know that they were talking about, funding. They want more, construction of toilets. They want cleanliness. They themselves talk about cleanliness, but they don't want to participate in the cleaning. So what we were trying to bring out in our message when we were down there in Katanga is that the challenges of funding will be there. KCCA may not have enough resources to manage everything. But if individually, in their homes, in their simple homes, they try to be clean, they try to dispose waste properly, they don't throw, because in Katanga, when it rains, that drainage overflows. It overflows, and why? Because we have polythene bags that are disposed anywhere that come and block those sewage systems and the drainage systems. So you find that the whole place is flooded with anything and everything. So the biggest problem that they were talking about, they needed, they need more support to have construction of toilets. They want KCCA to come and clean. But we are saying, okay, KCCA will come and clean. What about you? What is your responsibility? And I think this is something that we need to go back maybe when we are training our children, because there is a saying that train a child when they are young,
train up a child in a way that when they grow up, they will not depart.
They will not depart from what you have given them. I think we need to go back. I think the older generation, I don't want to sound pessimistic, but the older generation, there is a way we adjust.
Yes, that is true, because, in this home setting, you were trained to actually make sure your environment is catered to. So versus today where we are cleaning on phones and tabs. Absolutely.
We need to go back and inculcate. I remember when I was in Namagunga, and it somehow it stuck in me. I cannot cross lawn. I must follow where the path, because it was punishable to walk in the grass.
To walk in the grass. That's
and somehow it's stuck in wherever I go. If I can't find a path, I really get problems. I really
distorted.
Struggle. Why? Because that was inculcated in me to make sure that I don't walk on grass. I walk on the on the path.
On that regard, as we're walking on this path for better hygiene and sanitation, Dr. Twine, let's talk about the national policies that can help us get there. The already existing ones. Which ones should we amplify right now?
The national policy, we begin with the law. We have our Public Health Act that was amended. Before it was there, but it was very narrow and it was not inclusive. But now that the current Public Health Act gives us really a platform to improve the hygiene, sanitation, and all aspects of WASH. And it's not only in health, because when people hear about Public Health Act, it is not just only Ministry of Health that implements this Public Health Act. Everybody actually is a player. And we are in the process of now coming up with the regulations, and we want every sector to be part of this, because sanitation, hygiene, WASH is not just the aspect of health or KCC or urban health. It is about homes, it is about markets, it is about hotels, it is about environment. Like if you are on the street, it is about everybody. And so the policy that we came up with, it is really an inclusive, that everyone has a role to play. Ministry of Water and Environment has a big component. Ministry of Local Government has a big component. Ministry of Health has a big component. Urban, like in the cities, they have a big component. So this policy gives us a platform to improve sanitation. It gives the responsibility of everyone. Actually, it is punishable by, if you read the law, it is very clear. It's just that people don't know.
Okay.
To dispose waste, to neglect, to cause other people to fall sick because to dispose fecal matter anyhow, it is punishable. Oh. So what we are doing now, and we have come up with the policy in the Ministry of Health. What we are doing now, we are bringing other sectors to look at each component of the law, who is going to implement which part. I believe you maybe you could have talked about it before I came. We are also looking, we are linking it with environmental protection. These days climate change has become an issue. Why? Because we are not taking care of our environment. So all those things are intertwined. I may not, maybe we'll have another day to talk about that in detail. Okay. And what is in the Public Health Act, what should the common person know about that law, what is their responsibility, what are the penalties, if you do this, what is the penalty, what is the outcome of our actions. I think that is that maybe we could have that and another day.
All right, you talk about inclusiveness. I want to find out from you, how can the local government system be actually included in supporting implementation of policy and bridging the gaps in policy implementation? Because we're seeing it working for programs like the PDM. Adoption of it by the Ministry of Health could also maybe improve on our hygiene and sanitation.
You know, sanitation is not something new. Local government has been implementing this, except that when it comes to funding or when it comes to prioritizing resources for sanitation or for activities to do with sanitation and water and hygiene, has always been left on the low side. But yet we know that 75% of the diseases are related around that. Okay. But when it comes to allocating resources in the local government, and we had communicated to the districts that 30% of the PHC money that we send to them must be dedicated to dealing with the sanitation. But somehow you find some of the districts do not actually follow that funding requirement. We know and we acknowledge that right now, I think the resources that we put in for sanitation is not sufficient. Okay. And we have been discussing, we've been in the discussion with the Minister of Finance, because you know sanitation is a very big thing. If you broke down, you was talking about solid waste, just solid waste management. You have heard what has happened in Kampala here because of not giving it really priority that it deserves, what it caused us. So we have the solid waste, we have hygiene, we have water in our facilities, water in schools, hygiene in schools. So all those are components that can be played and managed by local government. On that note, Dr. Joyce was of the recommendation that there's increase in budget allocations at district level and also coordination of CSOs to eliminate duplication of responsibilities and work that they're doing. What's your comment on those? That's what we are advocating. We have had discussion with the Minister of Finance to see whether it's possible to allocate more funding. Okay. coordination of civil society organization. We started that. Actually, we have now a steering committee that brings all the players, even not only on the side of CSOs, but also in government. Because even in government, we have different government agencies that play the role in the in sanitation space.
Okay.
So we have brought them on board. The civil society organizations, there are so many civil society. I did not know that in that space there are so many. But you go down, you don't see. So we will really want people to tell us what they are doing, the accountability, so that we are accountable to each other.
All right.
We cut out duplication and we coordinate better.
All right.
But the message really...
That's what I was going to ask. What is your message to Ugandans and leaders, especially, regarding hygiene and sanitation, so that by the time we meet again next year, same time, we have moved some milestone?
The message to the people is that it is a noble cause. It is our human obligation. When God created us, He gave us, when He told Adam that go and manage the earth. Managing did not mean that go and waste and destroy the earth, no. So it is really our obligation to take care of our environment, because we will reduce on all this flooding of people sick in our hospitals. It is a shame that we still continue to see a lot of diarrhea in our hospital, people coming with diarrhea. Those things in other countries stopped. It is an abomination to see that up to now we are still registering cholera.
Okay.
Why? Because people have forgotten their responsibilities. And it is not, and you don't need to be very rich to be clean. Cleanliness is just a habit. We just need to adapt to be clean. And when we are clean, we prevent diseases. When we prevent diseases, we develop. Also, we become economically empowered. You cannot be economically empowered when we are still talking about diarrhea and cholera and typhoid in hospitals.
All right, that is a message to our leaders. Dr. Joyce, as a partner, allow me to give you 1 minute to give us your closing remarks and commitment.
Yeah, thank you very much. As WaterAid, but also as civil society organizations and development partners, we are committed to see that sanitation gets the attention it deserves. We have to make sure we prevent diseases so that we can reduce on the health costs and make sure there is increased productivity. But also, I'm looking at sanitation to be one of the pillars in the parish development model, so that it is really prioritized.
That's a good one. Dr. Nabasa, your closing remarks.
Yes, thank you so much. First of all, I want to inform the country that on 27th, we're going to be in Zimbabwe as the last mile of the sanitation week. So we'll be in a sub-county called Rwebtakuri sub-county, where the entire Masaka, Greater Masaka region will be present, and the entire country. So we call upon everybody to join us to commemorate and celebrate. The idea of celebrating is basically to raise the profile of sanitation and hygiene and make it important for everybody to take up.
Okay.
But also, most importantly, we need to rally the public to take up personal responsibility, like the PS said, because it's an individual responsibility. Lastly, we know that we are in the final stages of having our national cleaning days once the cabinet approves. So we want to start the culture of cleaning at a personal level, starting from your kitchen, starting from your house, starting from your food.
From your car. Mention the cars.
Yes.
People have cockroaches in their cars anyway. Because they're not taking care of the hygiene of their vehicle.
Recently we had an infestation of the bed bugs. The entire city, the tax park had an infestation.
We are opening up a can of worms. But ladies and gentlemen, thank you so much for the fight that you are pushing forward in your different positions of responsibility to ensure that we have improved national hygiene and sanitation. That brings us to the end of this discussion. Coming up is the community health insurance, tackling the national health insurance scheme. We do have a guest in that direction. Do stay with us.